Good afternoon and welcome to our daily media briefing. We've reached the midpoint of the week and we're going to be seeing a lot happening in the next couple of days. As you may have heard, the county yesterday approved a framework for businesses to reopen safely. The ultimate decision on reopening is going to be made by the governor, and we expect to hear more details tomorrow when the governor gives his press conference at noon regarding his earlier announcement about some businesses being allowed to open on Friday with restrictions. Those businesses include curbside retail, manufacturing, and logistics. We'll be following the governor's guidelines, but this framework we approved gives our local businesses a head start and a template they can fill out to plan for their safe reopening. What you see now is businesses can obtain that template on our website, which is displayed here on the podium, but I'll say it aloud for anyone listening to the audio feed. That is coronavirus-sd.com. This plan does not need to be submitted now, but we ask businesses to use it to prepare for when the state allows certain businesses to reopen. The template has measures like having employees wear facial coverings, requiring frequent disinfection of break rooms, bathrooms, and common areas, and placing signage around your establishment reminding people to maintain social distancing. We realize merchants may have questions about reopening, so we are working to establish a business question email system where you can send questions and receive a response. We hope to have that up and running within the next few days, very soon, so we'll keep you posted. And let me be clear about one thing. When more businesses start to reopen, it's not going to happen all at once. In fact, no matter what the governor says, it will be up to the permitted businesses to have their staffing and supplies ready to reopen Friday, and some may not be ready to do so. When they do, they'll be following new social distancing and facial covering protocols, among other things, to protect the safety of their customers and employees. Fortunately, we've gotten used to this new normal the last few weeks, and it shouldn't pose a great challenge for most of us. Please, let's not take it for granted. Remember that we've gotten to this point not because of a cure for coronavirus has been discovered, or a vaccine, or that cases have declined or deaths have stopped. We've gotten to this point because we've practiced social distancing, worn facial coverings, and washed our hands repeatedly. And we're going to need to continue to do that. I know these past few weeks have been hard, but I know that San Diegans have been up to the challenge. I was reading the paper this morning, and one item stuck out to me was from the archives column about Americans enduring wartime shortages during World War II. It mentioned how thousands of San Diegans registered to get their war ration books to buy restricted items like sugar, meat, and coffee. San Diego, we've suffered deprivation before, and we've persevered and come out of it stronger and better. I know we can do it again. We're in a fight against a different enemy, a silent, invisible enemy. We've had to put up with restrictions and hardships, but we're slowly coming out of this battle at this point. Let's keep up our good work, San Diego. With that, let me call up Supervisor Nathan Fletcher.
Thank you, and good afternoon. Today is National Nurses Day. This is normally a special day, but in the context of a global pandemic and in the context of all of the challenges and strains our healthcare system has been put on, our appreciation, our awareness, and our heartfelt sympathies and deep sense of gratitude to all of our nurses could not possibly be greater than it is in the time that we are going through. You often hear the phrase that not every hero wears capes, but in this case, they definitely wear scrubs. And so to each and every one of our nurses who's out there, whether you're in a hospital, an emergency room, whether you're at the convention center, at a skilled nursing facility, to each and every single nurse who's out there on this National Nurses Day, know that you have our eternal gratitude and thanks, and the actions that we are taking are designed to try and make your job a little bit easier and ensure that you have the ability to provide care and loving support and aid to every patient who comes your way. As Supervisor Cox just mentioned, there can be no economic recovery without the right planning and the right preparation. We have talked a lot from this podium over the last few months about learning to adapt, adapting to a new way of life, a new normal. That really being the month of April being a month of action, the month of May being a month of adapting to how we go about containing coronavirus and how our individual actions continue to be resolved and focused around slowing the spread. Things like face coverings, physical distancing, hand washing. But as we begin to continue the conversation and look for additional guidance from the state on what additional businesses can open, we want to continue to provide guidance to our businesses about the types of things that they will need to do in order to ensure that continued mindset of adaptation and the continued actions around containment are put in place. It was in March, actually, we first started talking about the need for temperature checks as a screening mechanism for employees who come in. We reiterated this considerably last month. We have socialized it and included it in our safety plan that's coming out. The reality is the only way we can come out of this and not see massive significant spikes is by changing our individual behavior and having ready surveillance in place to identify any individual out there with symptoms as best we can. Temperature checks are going to be a core part of this. And so the ability for businesses to do temperature checks for their employees when they come to work, any employee who's 100 degrees or more being not only sent home, but having a test ordered for them, they can rapidly get tested and work into our T3 system is going to be a critically important part of what we do. We know that thermometers can be difficult to obtain, and so it's why we have continued over the course of the past 2 months to talk about this piece of planning that needs to happen. It is included in our safety protocol, and we would encourage everyone out there to do their level best to prepare for the day that our businesses can expand and the number of places that can be open, understanding all the parameters that will have to be in place around things like physical distancing, hygiene protocols, temperature checks, and all of the other types of things that need to be encapsulated into that. Here at the County Emergency Operations Center, we go through the temperature check process every morning when you come into work. It is quick, it is seamless once you get it up and running, and so we encourage everyone out there, every business owner out there, to download the safety protocol that Supervisor Cox referenced, and whether you are open today or not, begin to think and plan for when that day will come. We often await guidance from the state, and when we get guidance from the state that we can move into a new stage or make a new series of entities available, provided we've met the outlined parameters, we want to be able to do that rapidly, and we want you to be able to open, if you are in that category of employers, as rapidly as possible. Some of that is what we're waiting on from the state, and some of it is your preparation in anticipation of that date, and so we encourage you to continue to prepare and be ready to go. No significant update on homeless reports from the convention center in terms of testing. I did want to give an overall of the total homeless population out of the entirety of San Diego County. We have now reported 36 total positives out of all of the positive cases for the entire county. The number from the convention center remains unchanged at 3. We've had 12 hospitalizations, cumulative, and 0 deaths reported. As it relates to testing, we do feel that many of the kinks that were present in yesterday's effort around the state testing facilities, these being the ones in Chula Vista, El Cajon, and Escondido, are being worked out. It appears that the testing at these 3 sites went much smoother today, and we expect to see much bigger numbers in terms of the reporting that's being done. And so we give our appreciation and thanks to all of those who are involved in working out the system. I would also note that San Diegans are utilizing the website and the phone number to make reservations. Every reservation at all 3 sites for the rest of the week has been taken. The appointments for next week have not yet opened, and so if you go to the website right now, you may not see any available appointments because they've all been taken for this week. Continue to check back when they unlock and release the times for next week. You will be able to get in the queue in order to sign up for that. To reiterate the overall approach to testing for individuals who are out there, we talk a lot about testing in our public health lab, our health system partners, our partnership with the state commercial labs. But I think it's important to reiterate to individual San Diegans the best way to go about getting tested. The single best option in order to get tested remains contacting your healthcare provider. Whoever you get your healthcare from, call them, talk to them about testing. They can schedule it for you. Our healthcare providers do a significant number of the regional testing, and they have the systems and protocols in place in order to do that. Your second option is to go to the state website, which we have shared, and it remains up on the county website, for how you can sign up for those 3 testing locations that I mentioned that are available. That would be the second best thing, secondary to your healthcare provider if you don't have one. And then your third option is to contact 211. But again, start with your healthcare provider, then utilize the state site that has been put up, and then third would be call 211. Now let's get into an update on our T3 strategy, testing, tracing, and tracking. Today we're reporting 2,260 tests reported, 65,737 total tests reported to us cumulative to date. We have 161 case investigators and contact tracers on hand, and we continue a very aggressive action to see this number increase and to get more trained, staffed, hired, and ready to go. 5,224 tests performed. We're up to 195 individuals are presently utilizing our public health motel rooms in isolation. We will continue to make these available for the duration of our coronavirus experience, and 579 cumulative individuals have received care and help in our public health motel rooms. Today we're reporting 159 new positive cases. This is out of the testing I just reported of 2,260. This represents 7%, little higher than our rolling average. But again, individual day-by-day numbers are less important than the overall trends. But again, 159 new positive cases out of 2,260. Very modest changes in our hospitalization. These are for COVID and COVID-suspected individuals in our area hospital systems, 133 in ICU, 363 total, with ICU being a subset of that 363. And here you can see the COVID-related hospitalizations of 363, non-COVID-related hospitalizations, and the total there, the total number of hospital beds currently being utilized, 3,598. And then last chart here is just our cumulative numbers. Wanted to reflect on here our current positive cumulative 4,319. Our estimated number of recoveries at 2,333. Cumulative hospitalizations, you can see there with that doubling every 33 days. Again, the doubling time average we've talked about before with exponential growth. ICU utilization, doubling time of every 35 days, and then the unfortunate loss of life now standing at 158. With that, I'll turn it over to Dr. Wilma Wooten for her Public Health Officer's report.
Thank you, Supervisor Fletcher, and good afternoon, everyone. Today's statistics for COVID-19 continues to increase in large due to increased testing efforts. The global, national, and state statistics based on data from the Johns Hopkins dashboard obtained at around noon today are as follows. Globally, there are over 3.7 million positive cases, including over 260,000 deaths. The United States is reporting over 1.2 million positive cases, including almost 72,000 deaths. Statewide, California has almost 59,000 positive cases, including 2,398 deaths. Today, the County of San Diego is reporting 4,319 cases, which is 159 more cases than yesterday, as well as 158 deaths, which is 8 more than reported yesterday. Of the total number of cases, the age range again remains constant, the youngest being 3 months, oldest 100 years of age. Of the total number of cases, ages 20 to 49 years of age make up 51% of the total. 2,106 or 49% are female, 2,206 or 51% are male, and 7 have no gender information provided. 882 or 20% of cases have been hospitalized. 281 of that 882, which represents 32% of the hospitalized cases, have been admitted to the ICU. The 158 deaths represent approximately 4% of the total number of cases. Of the 8 additional deaths, these include 3 females in their early to late 70s and mid-80s, 7 males in their mid-40s, early to mid-70s, and late 80s. Also, of the 158 deaths, 44% are female, 56% are male. And regarding race and ethnicity of the deaths, we have data for 92% of the 158 total, meaning 12 of those who have died have no information on race and ethnicity at this time. Of the remaining total, 72 or 49% are white, 57 or 39% are Hispanic or Latino, 10 or 7% are Asian, 4 or 3% are African American, and 1 or 1% exists each for American Indians, Pacific Islanders, and multiple races. My colleagues here at the county and I send out our sincerest sympathies and condolences to the families and the friends of those individuals who have been identified today losing their lives to COVID-19. In summary, lastly, as of today, 65,737 tests have been performed regionally to date, as demonstrated in this summary slide. As a reminder, all of our demographic information is found on our county website as provided on the website here and at the bottom of most of the slides. Regarding outbreaks in congregate and community settings, today we are reporting a cumulative total of 58 confirmed active outbreaks. 2 new outbreaks are reported since yesterday. There are 38 outbreaks in congregate facilities. This represents 1 new outbreak reported, which includes 971 cases and 82 deaths, and 20 active outbreaks in community setting locations, 1 new outbreak reported. Cumulatively, these represent 175 cases and 5 deaths. I have said it before, but it bears repeating. I want to say again that we continue to commend the public for staying the course and adhering to the stay-at-home order. Our collective efforts help to decrease the spread of COVID-19 as well as decrease the overall number of deaths over the past 2 months. Before closing, I want to note that also that today begins National Nurses Week, which is May 6th to May 12th. Next slide. It seems particularly relevant in this moment to say thank you to all of the nurses that have responded in the face of this public crisis, the global COVID-19 pandemic. Our nurses are an imperative part of the region's COVID-19 response, and without them, we would not be able to provide care to those needing services in San Diego County. So thank you for the sacrifices you make every day, and thank you for being public health heroes. We continue to monitor metrics that are currently trending in the right direction for COVID-19, and this is because of all of the help from our individual residents across the County of San Diego, organizations, businesses, and governments. So thank you to you as well. Now please welcome back to the podium Chairman Cox. Thank you.
Thank you, Dr. Wooten. We'll go right to the questions. Let me apologize again yesterday for the glitch we had with the phone-in calls. I think we're making up for it today. I think we got a few more. If you're not introduced by name and outlet, but we would ask you that you do so before you ask your question. So let's go to the first question.
Steve Walsh with KPBS. Please state your question. Yes, and so as we're already seeing lines outside of restaurants, and as restrictions are set to ease on the kind of businesses that can be open, who's going to be responsible if you have people on the street who aren't socially distanced or aren't wearing masks? Is the business going to be liable for that?
Dr. Wooten's going to respond.
So thank you for the question. And we recognize that some people are not going to adhere, but we realize that people adhering to our orders have gotten us to where we are today. So we have confidence in our San Diego County residents and our businesses that everyone will do the right thing. Our businesses to date have just been very innovative in adhering to social distancing strategies and implementing them. And there may be a few people that do not. And our law enforcement will do their part to enforce violation of the orders. But to date, everyone has really done a great job, and that is why our numbers are trending in the right direction. Thank you.
But will businesses themselves be liable if they have lines of people on the street who are not socially distanced or wearing masks?
We are asking each business to have a plan, and if you have gone to those that are currently open, you'll see those plans taped in the window so that they are visible to everyone. And we are asking businesses that are now allowing to open up for curbside, this is retail, for curbside business or engagement, as well as manufacturing. The businesses will be asked to ensure that the social distancing and the masking orders are adhered to. And if there's any problems with that, then they would report any violations to their law enforcement in the jurisdiction where they reside.
Thank you.
Okay, let's go to the next question.
Matt Hoffman with KPBS, please state your question.
Hi, thanks for your time. If someone who signs up for a test at one of these 3 new state-sponsored sites and then they get a positive result, what are they supposed to do? Are there any mandates or advice that you would have for them?
Okay, Rob Sills, the director of our Medical Operations Center, is going to respond.
Yes, thank you, Matt, for that question. All the people that are tested will be followed up by the OptumServe, which is the company, the contractor the state has contracted to do these testing. So a positive in your example would be contacted by the nursing team from there, and it also will be followed up through our epidemiology program here in the county. So.
I mean, should they be going out in public? Should they be staying at home? Are there any public health guidance that you would give to somebody who, as these test results start rolling in the next couple of days, what they should be doing?
Yes, when the epidemiologist calls, they will give those instructions, but Dr. McDonald has some further detail.
Sure. We do 2 things. We want to make sure that these individuals are hooked up to some medical follow-up, and if they don't already have medical follow-up, we'll make sure that that connection is made, usually via resources that are available through 211. But the specific advice has to do with the circumstances of the of why the test was done. If somebody was symptomatic, then they would be instructed to remain isolated for up to 10 days after the onset of symptoms and 3 days of decreasing symptoms, whichever is longer, as defined by CDC. And we go over that with each of the individuals when we do our epidemiology interviews. So the easy answer is if you have a positive test, you're going to be isolated for a period of time. And if you need help with that, then the county actually has some resources that we can bring to bear to assist with that.
Gotcha. And then I know testing is still limited. Along those lines, some people we were talking to today are wondering if multiple people in their family or house are showing symptoms, does everyone need to be tested, or can just one person be tested and that result sort of speaks for the entire household?
Well, we would actually encourage at this point individuals who are symptomatic to arrange to be tested, but The example that you gave, I think we would discover quickly in our epidemiologic investigation, and we would give advice to everyone in that household to be able to sequester those with symptoms from those who don't, and then understand who might need medical attention, and then go ahead and direct them to that. We would not wait for a test result to give them the advice that they need to protect the other members of their family or their neighbors.
Thank you.
Okay, let's go to the next question.
Kimberly Hunt with ABC 10 News. Please state your question.
Thank you. This actually dovetails well to the person prior to me. It's a couple of questions actually about testing, but it's also about reunification. Families have been separated from their parents and grandparents now for a couple of months, and at this point, people would like to visit, but they can't be sure without a test that they're not positive. What are your guidelines for reunification? What does that look like?
Okay, Dr. Wooten's going to respond.
So Kimberly, that could be several scenarios. If I understand your question, you're asking for those elderly or individuals over 65 that are sequestered in their homes in terms of interaction with their family members. Is that the question you're asking?
Yes, basically from a family member's point of view. If you're the younger person that may be asymptomatic, how do you visit grandma or grandpa without a test?
Well,
And if you do need the test, what's your advice?
No, actually, right now we are asking all elderly individuals to, if they do not already live with their family members, for them to stay sequestered, social distancing. So you might, and I'm sure you've seen on CNN where individuals are visiting their grandparents, whether they're young children, the grandchildren, or their children, and they are visiting them by standing in the yard with the grandparent being on the porch, because you do not want to introduce someone who's potentially infected, because now we also know that individuals can be asymptomatic or pre-symptomatic and still have the virus. So we will continue to recommend that our vulnerable populations, like individuals 65 years of age and older, stay at home. In terms of, that's where the serology testing, the PCR is really not a good test to determine whether or not someone can visit someone else, because, as I just stated, an individual might not have symptoms but be positive. So what we, in the future, once our serology task force or work group that is part of our laboratory testing task force, we will define what are strategies and how will we utilize serology testing to help engage and define the actions that our community will take going forward until a vaccine can be determined.
Can you clarify serology versus PCR? Is serology you're positive or not, and PCR is antibody? I'm not following you exactly.
Sure, a PCR test, or that is a test that determines if someone is actively infected today. So if you go to the doctor, you get a PCR test, it will be positive or negative. A serology test tests your blood, and also the PCR test tests either nasal or oropharyngeal. Serology tests your blood to determine if you've had the infection, thereby having antibodies in your blood that determine if you have previously been infected. Does that help you understand the difference?
Yes, thank you. And I do want to double back, because we are hearing from so many people. And so my initial question to you was reunification, where people are wanting to figure out if they will endanger a parent or a grandparent. And your answer was that those people should stay sequestered. It's been about 2 months now. How long are you going to ask that they stay alone in their homes and not see a family member?
So Kimberly, the whole reason for us doing all of this is because there is no vaccine, so that we can develop herd immunity, so that people do not, that might be potentially infected, infect others. We've had the stay-at-home order so that individuals that may have been infected, they go through their 14-day, if they have been exposed to someone, they go through the 14-day incubation period, and if they are infected, they will either self-isolate at home. If they need to go to the hospital, they will, that will happen. Right now, today, we are still in the throes of the stay-at-home order, and that order will be in place until it is changed by the governor, and we anticipate that some changes will occur beginning this Friday. But even with going from stage 1 where we are now to stage 2, we will continue to recommend that our older adults and those that are vulnerable still sequester themselves and stay away from the general public. Because this is the population that is most vulnerable, and this is the population, and if you look at our stats, in that age group, we see less infections than we do in the other age groups, and that is in large due to the fact that we have issued the order for individuals to stay at home. And I know it's stressful for people to be separated, but that's where we are at this point in time, Kimberly.
Yes, I understand. So eventually, if a vaccine is another year away, let's say, we're in May now, eventually, let's say, we're another 2 months down the road, 3 months, but eventually these family members have to see someone else.
Kimberly, we're going to have to cut you off. We've got a lot of other calls. If you want to call back in later, we can go ahead and try to work you in.
Yeah, it's for the reunification eventually. That is the question.
We'll have to get back to you on that one. Okay, let's go to the next caller.
Jill Castellano with iNews Source. Please state your question.
Hi, thanks for being here today. I have a couple questions. The first, at these press conferences, you've gone over the 5 federal criteria for reopening America and said that all the criteria must be met before forwarding to the next phase and beginning to open businesses, et cetera. But in the county news release yesterday, it said that the 5th criteria about the availability of testing, you're still working on that and it hasn't been met yet, even though the county is planning to move forward with reopening businesses Friday. So I just wanted to, if someone could respond to that and talk about that discrepancy.
Okay. Dr. Wooten's going to respond.
So the question about testing actually has various layers. What I shared at the board meeting on Tuesday is that we've met the first goal, which is to test. The goal that the state gave was 25,000 tests, and San Diego represents 8% of the statewide, of the state's population. So our portion of that would be 2,000. I shared that last week, on average, we tested about 2,200 tests a day for that week. So we have met that first goal. As we transition now to stage 2, the next goal, and the state is still landing on what the next goal will be, but right now it could be anywhere from 1 to 2 cases per 1,000. We have set for San Diego a top goal of 5,168, and that is the goal that we are ascending to and will achieve over the next, we anticipate we will achieve that over the next week. But we have met the first goal set by the state. So that's why we stated that we met the 5th goal.
Got it. Okay, thank you. And then just one other question. It's a bit long-winded. So all throughout these press briefings, we've been citing the improving metrics, 14-day downward trend in the rate of positive COVID-19 tests. But the data coming out of South County still seems to be trending in a different direction. The cases seem to be getting worse, not better. The infection rate continues to rise. The South Bay cases tend to be more serious too. We've been talking to hospital executives. They say that in South Bay we're seeing higher hospitalization rates and ICU visits. We talked to Chula Vista Mayor Mary Salas. She told us she'd like to see a downward trend in infections in her community before the county moves forward with reopening. Scriptia, when we talked to him, he said the projections are showing that loosening these stay-at-home restrictions probably or likely could lead to a spike in cases in their Chula Vista hospital, specifically when you isolate that south part of the county and look at those metrics. So I just want to ask, do you think that this push to reopen businesses could put that community, those South Bay communities, at risk? And what do you have in place to prepare for that possibility?
Dr. Wooten's going to respond.
So the metrics that we've repeatedly shared with the community exist for the entire county, specifically related to ILI and the COVID syndromic cases. We utilize that process every year for influenza. And when the overall percentage of emergency department visits go down to about 2, that usually means for influenza that the flu season is over. So we are at 2% of all emergency department visits are represented by influenza-like illnesses and also represented by COVID syndromic like illnesses that or symptoms. That includes fever, cough, and difficulty breathing or respiratory conditions. So we are there with that, and that is, we have to look at the entire region, not just one area throughout the county. So we've clearly met that, that metric.
Okay, thank you.
Before we go to the next call, we're going to, again, remind the callers to please keep yourself to one question and one follow-up question. We've got a lot of people that have called today, and so we want to get through them all. So let's go to the next call.
John Carroll with KPBS. Please state your question.
Supervisor, thanks for taking the time. You're no doubt aware that San Diego City Councilman Scott Sherman held a news conference this morning along with other local governmental and business leaders, calling on both the county and the state to speed up the reopening. As part of that news conference, El Cajon Mayor Bill Wells said that a good reason that we can do this is that the health care crisis, the possibility of overwhelming the healthcare system in the county has passed, that we should just move forward. Can I get your reaction or Supervisor Fletcher to that line of thinking?
Well, since Supervisor Fletcher has been on top of the numbers for the beginning, since the beginning of this crisis, I'm going to let him go ahead and respond.
Thank you. I think we all understand the desire to get back to work. Certainly everyone here understands that and feels that same desire. But we have to do it responsibly, and we have to do it in a way that makes sense. We also have to do it in a way concurrent with state guidance that comes out. And so we will continue to await that guidance and continue to do everything we can in order to do it the right way, in the right manner, at the right time. But the danger from coronavirus has not passed. The virus is exactly the same today as it was in February. It's exactly the same today in San Diego as it was in Detroit or New York or Italy or anywhere else. And so what we really have to get through is that as we come out of this, we really are talking about how we adapt our way of life and how we can come out of this being incredibly mindful that the integrity of our health system remains at risk if we don't do this responsibly, if we don't do it in the right order, and if we don't do it in the right way. I would also add that a significant challenge to rebuilding your economy is having the confidence of the customers and consumers out there that they are comfortable that you have in place the testing, the tracing, the treatment, that you have in place the capacity of the healthcare system, that you have in place temperature checks and screenings and safety protocols to ensure that they will be comfortable both returning to work and comfortable going out. And so, you know, from the beginning of this, we certainly understand the anxiety that folks feel and the economic distress, but that has to be balanced with the still present danger to public health and the reality that if we don't go through this responsibly, we could end up with a second wave that would cause a re-lockdown of all of these types of things, and that would not only compromise the integrity of our healthcare system, but that would be incredibly detrimental to an economic recovery. And so we continue to believe that the alignment of what is in the public health best interest is also in the rebuilding the economy, and that we do this smoothly, We do this slowly, we do this appropriately, and we do it consistently. And so we'll continue to work with the state, we'll continue to monitor the situation we face, continue to work with our healthcare partners in order to do this as expeditiously as is responsibly possible in San Diego County.
I'll spare everyone a follow-up. Thank you, sir.
Thank you. Next question.
Carlo Cicchetto with News 8. Please state your question.
Hi. Thanks for taking the question. This may be more of a state question, but I'm hopeful that there's some local guidance. As we move into phase 2 and more people go back to work, what about the work population? It's a small one, but 65 and over. That's a vulnerable population. We know. We've had the conversations about it already today. What about them? Are there going to be exceptions for them to be able to still isolate? Are they going to be able to continue their unemployment during this time because of the danger that is posed by them being exposed to the coronavirus?
Dr. Wooten's going to respond.
The guidelines from the feds state that if you have vulnerable populations, you work with them. You could coordinate their work as is being done right now. Have individuals telework. That's one strategy that can be used. But until we advance to the stages, the upstream stages, and we start to see the numbers go down, we will continue to tell our vulnerable populations to practice social distancing, wear the facial masks, as everyone is being asked to do, so that we can continue to protect them and so that they are not exposed and not become infected with COVID-19.
Will they be able to stay home, though, is what I'm asking? Because what if you mentioned telework, but what if there are people that work in a service sector, and by nature they'll be interacting with people, even with proper measures like masks, they will be getting within 6 feet, et cetera.
So again, if they are employed, that is something that would need to be worked out with their employer, but we are asking 65 years of age and older, particularly individuals with underlying medical conditions. It is a recommendation. It is not an executive order. We're asking those individuals to stay home. If they are working, we, depending upon the job, we are asking them to telework. So there are different strategies and solutions.
Okay, thank you.
Hey, Carlos, just to add to that, the state unemployment insurance system should still be available to those individuals who can't return to work for a medical reason. And so that would be another potential option that they could utilize along with expanded efforts around the state around sick pay and other types of things. So we think for individuals who medically can't return to work because of a condition, there will probably be some economic resources available to them.
Okay, let's go to the next question.
Danny Freeman with NBC7. Please state your question.
Afternoon, all. Quick question here, jumping off what Steve Walsh began talking about at the beginning of this session. We saw with the beaches opening, sheriff's deputies on patrol, lifeguards, city police officers enforcing state and local guidelines. Does the county have a plan to enforce businesses to comply with the guidelines and framework that the county put forward this weekend? Can we have a preview of what that will look like?
Okay. I think we'll have Supervisor Fletcher respond.
Thank you, Danny. Throughout this evolution, we've talked about the various enforcement mechanisms that are there, whether it be a public health order, something traditionally enforced by code compliance, things that law enforcement will do. But again, our hope would be that our employers care about their employees. And so the measures that are being proposed are efforts to protect their employees, they're to protect their customers. And so we think that is a good incentive and a good motivation. There's also the reality that if a business is not doing things that are responsible, they're also less likely to have significant numbers of customers. And so our hope would be, as has been from the very beginning, that there isn't the need for law enforcement to have to go away from the job that they're doing in order to enforce public health orders that are designed to protect everyone. And so we believe that, generally speaking, we've seen good compliance to date. We know that when there's a handful of isolated individuals who don't do it, it attracts a lot of attention. We'll go back, case in point, to the protesters. You may have 150 to 200 protesters out of 3.4 million people, and that attracts all the attention. But we neglect the 3.3 million people and change who are doing the right thing. And so we believe and we know that the public has adhered to these orders, has come together, has sacrificed, has committed, has done things. We believe employers will be responsible and will do the same. If there are egregious violations, then the enforcement mechanisms are there, but those really shouldn't be needed in order for us to come out of this the right way, given the widespread adherence we've seen to date.
Okay, let's go to our last call-in question.
Will Huntsberry with Voice of San Diego, please state your question.
Hi, everyone. So obviously, Los Angeles and San Diego have really expanded drive-through testing a great deal, and just expanded testing in general. But neither place is still seeing, all those tests be used. And we've talked about several reasons why that might be. Los Angeles has said that there's just not the demand for tests that they kind of thought that there might be. Is that true in San Diego too? That we just don't have the demand for the tests right now?
Okay, I think Supervisor Fletcher is going to respond.
Thank you, Will. We have all missed you dearly here the last few days. Welcome back. Look, I think there's a couple things that are going on. There's a couple things is in the initial posture, we told people if you're sick and have symptoms, stay home. You don't need a test. That was in large part because it wasn't available. Now we're transitioning into a phase where we have more availability of testing, but we still don't want everyone just showing up at a hospital who has symptoms. And so we're working through how to balance all of those things out with getting testing. What I would speak to when I talk about the demand for testing, the simple fact that every one of the available appointments at this state testing site has been filled throughout the entirety of the week tells us that there is a demand for testing. And so we believe that as we continue to find innovative and creative ways to fulfill that doesn't have everyone show up at the emergency room or the hospital, that we will continue to see utilization of that. As we continue to break through all of these barriers that get faced, again, all of the components that go into a test, from the way that you order it, to the nurse that takes the swab, to the PPE, to the swab, to the reagent, to the device, as we continue to break through all of those, we think that we will also continue to see increases in testing. And as we continue our aggressive efforts to get out to congregate care settings, to test everyone who's there, both resident and staff, as we continue to look at vulnerable populations, as we continue to try and move resources to areas that have historic inequities in access to health care, as we continue to do all those things, I think you'll see our numbers will continue to increase and continue to creep up. But it is as you well know, and as folks know who have been watching, this is not a pregnancy test. You just pull off the shelf and then it gives you a result. It's a little bit more challenging than that. I think in totality, San Diego County has done well, not as well as we want to do, which is why we have a goal that's significantly higher than where we want to be. But we think that as these systems get worked out, as these protocols get worked out, as it becomes more available, as it becomes easier to sign up, as we have more ready supply of personal protective equipment and components, we believe that the numbers will continue to increase. I think the demand is there. It's just trying to match the demand in a way that is responsible to actually accomplish the goal of testing. And another point on testing is there will be, likely a number of individuals who get tested multiple times. And so that could be true with frontline healthcare workers. That could be true with someone who's positive, needs a negative. And so, we're going to continue to assess on a daily basis everything we need to do to break down every different barrier to increase not just the availability but the utilization of testing in order to get to that floor of 5,200 and then continue to grow beyond that.
So my one follow-up here, obviously you guys have created a testing task force, and they have released some new guidelines about who should be tested. There are a lot of asymptomatic people on the list, frontline healthcare workers, things like that. But what's not on the list or has not been mentioned as part of the plan is testing people who have come into contact with a confirmed positive case. Is there any plan to make that part of the testing strategy?
Well, I've talked about that multiple times. That's really a part of the tracing strategy. As you have those individuals who test positive and you contact trace those close contacts, the opportunity to make testing available to them is certainly going to be a part of the ongoing effort of what we do.
Is it happening now?
So, Will, if an individual has come in contact with a confirmed case, then they would be quarantined to watch for symptoms. If they have symptoms and they have been in contact with someone who is confirmed, yes, we would recommend that they be tested. And that is not a new process.
Thank you so much. Good to be back.
We missed you. We'll now go to the texted questions, and I think the first one is dealing with the Otay Mesa Detention Center, so Dr. Wooten's going to respond to that.
Dr. McDonald. Dr. McDonald.
Dr. McDonald's going to respond.
This is from Mario from CBS 8. Can you please confirm any details of a COVID-19 related death at the Otay Mesa Detention Facility, and how many others have been tested positive there?
Well, we can confirm that we had a report this morning of a 57-year-old male detainee who had formerly been at the Otay Mesa Detention Facility and had been hospitalized since late April. Did die early this morning from complications of COVID, and that death is not included in the statistics that Dr. Wooten presented today. As far as other details of the outbreak at Otay Mesa, I will say that it is the largest outbreak in the county of San Diego, but the details should be provided by the facility itself. We have been working in support of that federal facility. The actual outbreak management, infection control, contact tracing, and protocols that they follow are all federal protocols that are under the auspices of the Immigrations and Customs Enforcement, and also the U.S. Marshals Service, who are the federal organizations that have detainees and prisoners at that facility. So we have supported that outbreak control effort by giving them infection control advice, by providing testing when asked for. We did that early in the outbreak, but they've been able to arrange their own testing since then. We've given them testing equipment at times, and we've also provided them PPE when they need it. We've asked if they needed any staffing support, and they have indicated that they don't need it. But any further details on this incident and also the management of the outbreak should go to ICE.
Thank you, Dr. McDonald.
This next question deals with cool zones in the unincorporated area, and Dr. Wooten's going to respond.
Yes, without the ability to open cool zones, is there any plan in place to help residents who don't have air conditioning as we deal with higher temperatures in summer?
So thank you for that pertinent question. At this point in time, we will not be opening cool zones, but we hope to open them later in the month, as we hope that we can transition from stage 2 to the next stage based on whether we meet criteria for that. But for this week, and obviously last week when the last heat advisory went out, no cool zones are open at this time because the risk outweigh the benefit. So we are providing fans to individuals, and I know this question is focused on those individuals without air conditioner, but previously we've also found that people with air conditioners also were going to the cool zones. So we would recommend that those people with air conditioners use them so that they can stay comfortable, and that those without, we will are available to provide fans to them.
And Dr. Wooten, I have another question. This is from Michael Hart with Julian News. Is the county planning on opening areas of the county in phases, for example, rural areas at a different pace?
No, we are the County of San Diego, the County of One, and I know that we've heard comments about the infections might be, cases, numbers might be different in one region than the other. But no, a simple no to that question. We are opening up the county based on the recommendations from the governor's office, and then where we can make other changes and recommendations, we are doing that, as has already been evidenced by the changes in orders for beaches, parks, and golf courses. And we will be making additional changes on Friday as well. So that has been our strategy and will continue to be our strategy.
And Dr. Wooten, if you don't mind, this is also about reunification. Now, prior to a vaccine, how will you eventually be able to reunify with a parent? Will you be tested first, or what will the process look like?
We don't know the process of how we will use serology, and that example would best probably be utilized with serology testing. We have a work group that's working out that overall strategy. So for the questions about reunification, I cannot give you a specific answer at this time, but that really aligns with the county's and the nation's progression from one stage. If it's at our California our California statewide stage transition, or whether it is utilizing the federal phases transition.
Thank you, Dr. Wooten. I have one from Stephanie with Fox 5. If an essential worker comes into contact with a fellow worker who tests positive for coronavirus and is sent home for 14 days because of that contact, can they return to work before the 14 days is up if they themselves test negative?
Well, that's the whole point of incubation period. You can develop symptoms as early as 2 days or as late as 4 days. So it depends. At any given day, you could be negative, but in the next 24 hours or the next 2 days or 3 days, you could be positive. So no to the question.
Okay. And we have one last text question from Andrew from Fox 5. What does the county have to say to some of the San Diego City leaders who are wanting the governor to allow the county to streamline phase 2 process to allow more businesses to reopen?
Well, the governor has given, at least what we were told on Monday, that could change, and we are waiting for additional guidance. But after the initial guidance for transitioning from stage 1 to stage 2, he did say counties could accelerate stage 2, and we call it here 2+, to add on more conditions of loosening up. But again, we need to get further directions from the state, so we do not have that at this point. We will, as far as we know today, we're looking at what we can do with retail, curbside, as well as manufacturers and any supply streams into the manufacturer industry.
Thank you, Dr. Wooten.
Well, that concludes it for questions today. Before we close up, I would like to join Dr. Wooten and Supervisor Fletcher in congratulating all of our nurses for National Nurses Day and the beginning of National Nurses Week. Now more than ever, we appreciate our nurses, and I want to thank our county public health nurses and nurses in hospitals, community clinics, nursing homes, and really throughout the region for being on the front lines of this fight against the pandemic. We want to thank you again so much. If you missed anything or you have questions, please remember that our information will be updated on the website, coronavirus-sd.com, so please check that site regularly. That's it for today. We'll be back tomorrow at 2:30. And again, remember to stay in place, maintain space, and cover your face. Thank you.